Hello everyone, I'm Dr. Susan Protasio, your host, and this is This Conversation Matters podcast. February 23 until March 1 is the National Eating Disorder Awareness Week. So today, my guest and I will be talking about eating disorders in children, which is often underdiagnosed and a hidden problem. Our guest today is the Staff Development Officer for the Mindful Body and Recovery Program in Riverside University Health System Behavioral Health, where she leads the first county-run eating disorder intensive outpatient program. And she also holds a Doctor of Education in Organizational Leadership, MBA in Human Resources, and a Bachelor of Science in Psychology from UC San Diego. So let's welcome our guest, Dr. Gibran Blakely. Welcome, Dr. Blakely.
Thank you so much, Dr. Susan. I appreciate you having me here.
Thank you too for your presence. So I'm sure our audience would like to know more about you. So could you say a little bit more about yourself?
Okay, I will. Again, my name is Dr. Gibran Blakely. I am the Staff Development Officer at Riverside University Health System Behavioral Health. And I work with the Mindful Body and Recovery Program, which is an eating disorders awareness, treatment, and community education program that just started this past year in the city of Paris. I assist with doing outreach to underserved communities. I also do community education and presentations, workshops to various community agencies and professionals in healthcare and behavioral health. I also support the clinical team on site and coordinate cultural competency trainings for our staff as well.
Thank you, thank you. So as the Staff Development Officer for the Mindful Body and Recovery Program, can you share with us what is eating disorder?
Eating disorders are a serious mental illness that involves disturbance in eating behaviors and patterns. It affects a person's thought processes about the food that they eat, their weight, their body image. They may have the perception that they weigh too much when they may be at what we would consider a normal weight. And it also may affect be affected by them having other disorders such as anxiety or depression, may cause shame or guilt, and some of these behaviors. It also affects their physical well-being, their mental health, and it can be impacted by genetics, trauma, stress, or other environmental factors.
A lot of these factors. So your program, the MBR or Mindful Body and Recovery Program, was launched in May 2025. So what led to the launching of this program?
Riverside County discovered that there was a specialized need for additional specialty mental health treatment, specifically in the areas of eating disorders. There are several treatment centers in between San Bernardino and Riverside County, but nothing specific to intensive outpatient program. Sometimes clients would need to travel outside of the county to get treatment, and within the county, we actually offered this program under the Mental Health Services Act, which is an innovation project through RUHS Behavioral Health. So it allows us to go out and reach underserved communities, incorporate cultural responsive care within our programming and our treatment, and it also gives us an opportunity to share and educate the community, the families who may not know much about eating disorders.
So actually your program is filling the gap.
Yes.
From the need of the community. So what particular age does your program focus at?
Right now we focus on youth ages 12 to 18. And we educate all other ages, families, educators, healthcare professionals, and then we'll be focusing on transitional age youth, 18 to 25 in the next month or so.
So you're working on that age group, the 18 to 25.
Yes.
So why that particular age group?
Within the ages of 10 to 25, those are very impressionable times as a youth growing up between the teenage years and those early adulthood time frame where they're in between pediatric care and adult services, and there's so much influence from social media and cultural factors that are really affecting these young people and their image of themselves, their perceptions of their bodies, their weight, that pressure to look and be something they see on a screen. So this is a really impressionable age, and we really want to focus in on them getting that treatment sooner.
That's good. So who are the people that are at risk for eating disorders?
Typically, adolescents are most at risk, young adults, just because, again, of the cultural and social factors that, we have, especially, teenagers in middle school and high school who may face peer pressure or other factors that, would cause them to want to change or the way that they see themselves.
Yeah. And then also, I read an article from the website of the National Eating Disorders, and they categorize the risk factors into biological, psychological, and sociocultural risk factors. And like you said, family history, it falls under the biological risk factor. So if you have a relative that is with eating disorders or a relative with a mental health conditions like anxiety, depression, then it becomes a risk factor. Now, for the psychological risk factor, what we said, perfectionism, that is self-directed. So it creates we create like a high unrealistic expectations from ourselves. And also the sociocultural factors like the bullying and also like the stigma on weight. So what are the most common types of eating disorders that you encounter in your program, and what are the most symptoms that they present?
Okay, so the most common, there will be 3, but there are several others that we could go into as well. I'll talk specifically about anorexia nervosa, which has to do with restricting eating, an intense fear of gaining weight, as well as having a distorted body image. This might be a teenager who is medically underweight and they're anxious when someone asks them to eat a meal or a snack. They insist that they're too big. Bulimia nervosa. It involves cycles of binge eating, and then they have compensatory behaviors such as vomiting or excessive exercise immediately after, like what we consider a purge. This might be someone who secretly eats late at night after a stressful day and then makes up for it by purging in their room or in the shower. And then there's ARFID, which is avoidant restrictive food intake disorder. This might be a person who has sensory sensitivities. They have a fear of choking or vomiting or low interest in eating, so they just choose not to eat certain foods. It has nothing to do with their body weight or their body image. This might be a child who had a situation where they choked on a specific food and they don't want that to happen again, so they only eat certain foods. Some of the symptoms for anorexia may include irregular heartbeat, dizziness, low electrolytes. Bulimia may include irregular menstrual cycle, scars on their hands because they are putting their hands in their mouth to purge, as well as issues with their gastric reflex. And then ARFID may cause avoidance of food. So they may be limited to food and have a low body weight, which could eventually cause them to go into anorexia if their healthy body weight decreases too much.
So, and also in anorexia nervosa, the youth or whoever the patient is, they restrict the calorie intake to extreme. So now it can lead to malnutrition. So this is really a potentially dangerous illness. And then on bulimia, like you said, they eat so much, like impulsively, and then they feel guilty and shameful. So now their tendency is to do unintentional vomiting. The vomiting is like they kind of intentionally doing it for them, so they could remove the calories that they ate. So that's the difference on that. So what are the treatment recommendations then on your program for these eating disorders?
So we do offer individual therapy where our therapists focus on cognitive-based therapy and dialectical-based therapy. Those therapy modalities typically focus on coping skills and supporting behavioral change. A lot of it relates to how they're able to regulate their emotions as it relates to food. We also have family-based therapy where the family is held accountable as well. They are included in every step of the process within our program, and it empowers the caregiver to restore healthy eating habits within the home. We also have a registered dietitian who offers nutritional counseling, giving guidance with meal planning, food exposures, normalized eating. And then we have a registered nurse who does medical monitoring where they do regular checks of their vital signs. They make sure that they review their labs and they make sure that the patient is medically stable. Then we have our paraprofessionals who can facilitate life skills groups. So again, it helps with emotional regulation, life skills. We talk about body image, ways to cope and de-stress. And then our others, we also have parent management training where the parents are also included. They go through dialectical behavioral therapy, the family therapy sessions, and then we're trying to give them the tools to help educate them so that they can continue to assist their loved one in the home.
Are those blood pressure or monitoring vital signs, they are done when the patient comes into the program?
Yes, our registered nurse takes vitals every visit that the child is in our clinic.
Okay. I wonder, is there a criteria that they need to meet to be included to the program?
The most important is that they meet the age criteria in our current age group of 12 to 18. They must be struggling with at least some type of symptom or concern of an eating disorder. They also have to fulfill specific medical tests. They get an EKG to monitor their heart rate, specific urine tests, thyroid panel, additional labs that the doctor will submit to us within 30 days of enrollment of the program. And we want to make sure that they also get assessed by our clinical staff, our psychiatrists, as well as our clinical therapists, dietitian, and nurse.
When a patient presents to your program, they are being assessed, and then once they met the criteria, then they enter your the MDR program.
Yes.
Okay, so that's nice. So I wonder, is the eating disorder culturally affected? Like if let's say an Asian youth would present symptoms, would that symptoms be different if the other one affected is like Hispanic or like a non-white non-Hispanic Caucasians?
Typically with eating disorders, it can occur and it happens to anyone despite what their racial or ethnic group is or age or their gender. The difference is that in some cultural communities, and often due to various health disparities in healthcare, the symptoms might be overlooked, misinterpreted, misdiagnosed, underdiagnosed. There may be stigma where the family, specifically to that culture, may not want the child to share their family information with healthcare or school professionals or behavioral health professionals.
So it becomes underdiagnosed.
Yes. There's
Yeah, so it just came to my mind. So like I'm Asian, so in our culture, when a child does not want to eat, the parents or whoever the caretaker will get angry or get mad. Why are you not eating? Eat this, eat that. And they kind of like insist for the child to eat whatever is in there, but we're not into like looking at why is this child not eating,
Right.
What is the reason why? So we just assume that the child doesn't want to eat. So I think probably that's one reason too that that culturally that can affect the eating disorder. So how do we talk to people with eating disorders?
We have to be really supportive.
Okay.
We really want to make sure that we are being compassionate, that we're not making comments about their weight or their appearance, that we're being supportive, and that we help guide them to specific resources that can help support them in getting treatment, whether that's, outpatient or our program. It's a difficult type of disorder, and it's very secret, very shameful, a lot of guilt included. So we want to support that person as much as possible.
And also, I think what would help is use language that are compassionate, and then talk to them coming from the point of view of like using I instead of you. So to kind of, diffuse a little bit the resistance that they would feel from talking about the eating disorders. That way it reduces defensiveness, right? And also, I read an article that says there are ways that we could help your child develop a healthy body image or healthy eating habits. Like number one is that was recommended was avoid dieting in the presence of the child, because it says that when you diet in their presence, the family eating habits become reflected on the child, and now the child's view of eating can be affected. Another suggested way is talk to the children about body image, encourage them to build a healthy self-esteem. Another one is talk to the children about the social media. There are certain social media that, give or recommend really dieting tips or bad healthy healthy but eating habits. And then another one that was recommended too was when it is time for your child's doctor's visit, check with your doctor, ask your doctor, and see if the doctor can help you if you have concerns about eating symptoms. So those are good ones. So how about the presence of eating disorders in population of the LGBTQA? Do you see patients from that population group in your program?
Yes, that's another population that's at higher risk. A lot of individuals in the LGBTIQ plus community have a lot of identity related stress. They face discrimination, they face bullying, as well as a lack of acceptance. And so there's a higher risk for these individuals to have an eating disorder because of those concerns about their body image. There aren't too many places that now, especially with a lot of changes in the government and guidelines and things like that, where they are not able to seek out gender affirming care. So in order to, get that acceptance, they may continue on and restrict their eating or partake in bulimia and nervosa type behaviors.
Just to maintain that body image or self-image that they have created in their mind.
Yes.
So if there is someone watching us right now and wanted to reach out to your program either for themselves or for a relative, how do they reach out to your program?
The easiest way is for a person to contact the Riverside University Health System CARES Access and Referral Line. That is a phone number where anyone can call to be referred to any specific program. They would want to make sure that they specify that they have concerns about an eating disorder, and then they'll be referred accordingly throughout our program. Another option would be to contact the Mindful Body and Recovery Program directly. Our phone number is 951-210-1750, and then we will connect them with a therapist, set them up for an appointment for an assessment. They can also talk to their healthcare provider, their pediatrician, their own therapist who can refer them as well. And, just seek out those resources, even in the school, their school counselors, to search.
They could talk to and approach and say, hey, I have this concern.
Yes.
So now, since your program, the Mindful Body and Recovery Program, is basically for Riverside, right? So let's say someone watching us is like a different state and would they be able to call this helpline or access line and inquire about the eating disorder?
They can contact our program directly and maybe we can assist them with some resources. I would also recommend looking at some of the national resources out there. The National Eating Disorders Association is a good one. FEAST is an organization that helps families, as well as a National Alliance on Eating Disorders. So those would be, those would be some resources that can help get them connected with facilities in their own area.
Areas, because I assume that every area too, or every state, they have their own program for that.
Correct.
Right. So if there's one thing that you would like to say to our audience, what would that be?
Eating disorders are treatable, and recovery is possible. It's just really important to seek out those resources and support early and not brush it off. If you feel like your child has an eating disorder or their mood changes or their eating patterns change, trust your instincts and reach out for help. Speaking up is going to make so much of a difference to your child and their livelihood and their life. Also to our healthcare professionals, usually you're the first person in the line of detection. So early screening, asking the right questions, taking those concerns seriously can really make a difference in the child's life, in their recovery and in their treatment. The symptoms aren't always obvious, so we want to make sure that if you even detect it, that you're connecting them to the correct resources for help.
Yeah. I agree with what you said, that sometimes the symptoms are so mild that you just assume that, hey, probably this kid, because being young, is just being moody, you know? So any sign of like a little doubt or curiosity of what is going on, then probably ask for help, right? So thank you so much, Dr. Blakely, for this very informative conversation and for bringing awareness on the eating disorders. There is so much to talk about eating disorder. It is a very complex illness, but due to the limited time that we have, if you have more questions, probably consult your primary care physicians and get some help, or you could reach out or to this number of the Riverside University Health System CARES Access and Referral Line at 1-800-499-3008. And before we end this episode, I would like to share with you this quote from Lily Collins, and it says, "Asking for help is never a sign of weakness. It is one of the bravest things you could do, and it can save your life." So thank you so much for watching. Take care of yourselves. Blessings.